Hello, my name is Mark Van Houten, and I am a board-certified neurologist in solo practice in Irvine, California. A significant number of people worldwide experience recurrent, intense headaches during the course of their lives. An intense headache can be very frightening. You wonder, do I have a brain tumor, a ruptured aneurysm, hydrocephalus, perhaps a stroke? Fortunately, modern imaging techniques of the brain can quickly determine if you have any of these conditions and quickly rule them out. So let's imagine for a moment that you have this intense pounding headache with nausea, light and sound make it just worse, and you're dizzy, you can't speak normally, and you see flashes in your eyes, and your arms feel dead, and your body, your head is tingling. Then you go into the MRI scanner of the brain at that very moment, and the brain images look normal. So why do you have a headache? Well, you might be experiencing a neurologic headache that we call migraine, which is a result of activated pain circuits in your own brain. So what part of the brain would cause a headache, and why would my brain do this to me? Well, the part of the brain that generates the migraine pain signal is the brainstem. So here's a model of the human brain facing you. Here's the eyes, there's the ears. This very deep part of the brain in this area here, this little bulbous area here, is called the brainstem. The brainstem governs all sensory processing for the head and upper neck, and it's thought that people with migraine have activation of pain circuits in your own brainstem that feel like you have a headache. So why would the brainstem do this to you? Well, let's spend some time talking about neuroanatomy of the brain and the brainstem. So let's take the brain and turn it on its side, and then we're going to cut the brain open here and take a look at the brain from the inside. So here is the hemibrain seen from the inside. This bulbous area here of your lower brain is called the brainstem. It connects your spinal cord with your brain. But if you look at the simple shape of the brainstem, it looks like an extension of your spinal cord, like the knob on top of a cane. Well, it turns out the brainstem and the spinal cord are the most important parts of the nervous system for collecting all the sensory data of your body from head to toe and organizing all those little tiny nerve-ending inputs into comprehensive integrated signal patterns that tell your brain what different parts of your body feel like when all the little nerve endings are put together in the proper configuration. The same way your cable system works at home. If you have cable service, you have a wire that brings to your house pixels, but you don't see pixels on your TV screen because you have a converter box. What's the converter box do? It collects all the thousands of pixels streaming in and transforms them into an integrated electronic circuitry pattern that allows the converter box to integrate and generate an image on the screen that faithfully represents the information coming in through the pixels. So you don't even see the pixels coming in, you simply see how your converter boxes transform the pixels into an integrated pattern that you see as an image on your screen. So if something should disrupt your converter box, well, the image on the screen will look all distorted, not because the pixels are faulty, it's because your converter box failed to integrate the signals correctly into the proper configuration, and you're inducing a distortion in your image. Well, the brainstem and the spinal cord are the converter boxes of your nervous system, collecting all the sensory data and transforming it into configurations of information that tell your brain what different parts of your body feel like. And the brainstem governs all sensory integration for the head and neck, and the spinal cord for the arms and legs. Like your hand. You have millions of nerve endings in your hand, but you don't feel nerve endings all day because you feel your hand. You feel the result of all those little tiny nerve endings in your hand sending little pixels of information into your spinal cord, which is a converter box, collects all the pixels, integrates them into proper configuration, and then sends a signal pattern to the brain, and the brain decodes that is what the hand feels like when all the little nerve endings are put back together in the proper configuration. So you don't feel your hand one nerve ending at a time, you feel only what your spinal cord says your hand feels like based upon how it integrated the pixels. So if something should disrupt your spinal cord, well, your hand can feel different. It could feel painful or numb, heavy, weak. Nothing wrong with the arm or hand. It's the integrated signal pattern which is introducing the distortion because there's something wrong with your spinal cord. The same thing with the head and neck. You don't feel every single nerve ending of your head and upper neck directly. They have to be collected by your brainstem where they're integrated into the configuration that truly represents the information coming from your head or neck. So if you bumped your head one day and you traumatized 1,000 nerve endings, you don't feel 1,000 nerve endings. You feel some region of your head which has a uniform integrated pain signal indicating that the brainstem has faithfully collected the information and reconfigured it just right to tell you about what that part of your head feels like. But let's say you didn't hit your head and the scans of the brain don't show anything wrong with your brain. Why would you feel head pain? Well, because your brainstem said so. But why would your brainstem make up a false pain signal if there were no pain signals coming in? Well, current thinking in the field of migraine is that if you have migrainous headaches, there may be a fundamental defect in your converter box. You may have neurologic circuits in your brainstem that activate the integrated system and send the configuration to your brain. Your brain says, yes, I feel that pain signal over my head. Well, of course you do. It's your pain system which has been activated. But it's been activated because of some internal disturbance within the own integrated system and nothing physically wrong with your brain. So what's wrong with your converter box? Well, current thinking is that the principal circuitry pattern that plays an important role in activating the pain circuitry seems to be the serotonin network. Now, serotonin is simply a neurotransmitter. It's a little molecule, nothing wrong with the chemical serotonin. But serotonin is the neurotransmitter used by the integrated system to activate the pain programs. Your serotonin network is embedded in your brainstem where it has lots of local connections with brain circuitry patterns involving the production of pain signals. The serotonin network can also influence your gyroscope, giving you dizzy or vertigo feelings. It can influence the area of the brain involving integration of pain signals for your stomach, give you a feeling of nausea. It can influence heart rate. As well, the serotonin system is not confined to the brainstem just for sensory integration, but also plays an important reciprocal role in the regulation of a part of the brain called the limbic brain. The limbic brain is the part of the brain which is involved in psychic phenomena like mood, sleep, concentration, memory. So current thinking is that if you have headaches which have migraine properties on this branch of the tree, or tension headaches to some extent, some people bounce back and forth, or a lot of upper neck pain, and there's nothing physically wrong with your head to cause that, then we might think of the headache as being due to a change in the balance of the serotonin network to a destabilization, where there is hyperactivity in the system and activation of pain circuits, which can produce head pain and be associated with dizzy sensations, numbness and heaviness of the arms and legs, tingling of the face and scalp, and sometimes visual patterns of sparkles and visual changes of all sorts. Now again, the serotonin network is not confined to just brainstem activity. It can also play an important role in the limbic brain. So activation of the serotonin network can also cause an anxious moment, even a panic attack. It can activate serotonin systems within your upper brainstem involved in the biological rhythms of sleep and cause insomnia or fragmented sleep patterns. It can influence limbic center functions involved in emotional stability of mood and energy levels. And it can also cause disturbances of simple memory processing and concentration. So not uncommonly, people with migraine activity may, with or without the headache, have panic attacks, fragmented sleep patterns, changes in moods, or even difficulties in concentrating and formulating the words correctly, even if not having a headache at that very moment. So how does the serotonin system get to be so unstable? Well, current understanding is that the ability for an individual to experience fluctuations in their serotonin patterns may actually be a genetic trait. Not uncommon, you'll see parents, brothers or sisters, or other people in the family who are also headache prone or have other disturbances in their limbic system. These fluctuations in serotonin activity can begin at any age, sometimes in youngsters, and then undergo various fluctuations throughout a person's lifetime. Sometimes those fluctuations can be augmented or modified by environmental factors, both internal and external. For example, some people can't have a red wine or maybe MSG because the chemicals in those substances lower the threshold for activation and can produce a headache, not uncommonly. Estrogens are also a very important factor in some people's headache patterns. The part of the brain which is involved in estrogen regulation or reproductive cycles is in your hypothalamus, which is in the upper end of your brainstem. The hypothalamus regulates the formation of hormones from your pituitary gland that orchestrates the menstrual cycles. Your hypothalamus contains complex networks of nerve cells that act like a clock. They tick-tock the days of the month. And when the clock strikes 12, they may activate the pituitary to produce a hormone, but they may also inadvertently activate your serotonin network and give you a menstrual headache. So in that situation, the migraine is activated by the internal processes of your own brain related to the cyclic biological rhythms of your hypothalamus. In some individuals, estrogens alone can alter the balance of these neurologic circuits because the brainstem does contain nerve cells with hormone receptors for estrogen. So sometimes adding estrogen or decreasing estrogen through birth control pills may augment or modify your headache pattern. So some people get more headaches if they're on birth control pills, and some have less headaches. So the hypothalamic system involving reproductive cycles may change during the course of a person's lifetime. Many individuals notice the first onset of their headaches when they first start getting menstrual periods as a young woman. And they may become associated with menstrual periods throughout their lifetime. As they get older into their middle years, the menopausal years may also introduce new fluctuations in the brain circuitry pattern. During menopause or perimenopause, there is a change in the clock. Your clock starts getting very irregular. You start seeing irregularities in menstrual patterns. And that may also induce some instabilities of serotonin networks and neighboring networks. So during the perimenopausal phase, there can be changes in hypothalamic activity which will undermine the stability of your serotonin network and produce many of these common problems which are seen in the perimenopausal stage, which could be change in headache patterns, more difficulties in concentrating and thinking clearly, changes in mood, stress tolerance, changes in sleep patterns, and even changes in levels of being at ease or not. That may be associated with more standard perimenopausal changes of changes in the posterior hypothalamus, which is your thermostat. So you may also see changes in fluctuations in thermostatic temperature regulation as well. Other factors may play a role in migraine histories over the course of a lifetime. Sometimes enhanced levels of psychic stressors by way of the limbic system's hyperactivity will feed back on the serotonin network of your brainstem, so that stressors sometimes can undermine that stability and make you more headache prone during periods of stress. Other factors are also important to consider. In some individuals, they get a fairly regular repeated pattern of headache activity, migrainous and tension-like, and the response of their physicians is to try to treat just the pain alone without actually treating the source of the pain signal. So your doctor may give you ibuprofens, Motrins, and any number of over-the-counter agents or even narcotic agents in the hopes that that's going to help reduce the headache. But what they may be doing inadvertently through overuse of analgesics is adding to the instability of these networks, which are seeing fluctuations of analgesics, and they may enhance the level of instability in your serotonin network. So overuse, and particularly daily use of over-the-counter and pain medicines, may actually convert a standard migraine pattern into a very frequent low-grade headache cycle. So if you have migraines that are getting more active and your doctor offers you over-the-counter pain medicines, say, no thanks, I don't need that, it's just going to make the problem worse. I will try to find a better solution. Head trauma is also an interesting topic. Sometimes after head trauma, people will experience headaches which have very common properties to migraine. You might look at this, the way head trauma occurs. If the brain is inside the box of the skull and the spinal cord has the spinal cord, if the spinal bones have the spinal cord intact, then head injuries cause a kind of a fulcrum effect between the spinal cord and the brain may be putting undue stress on the brain stem, and that type of activation of head trauma may also induce an instability of these serotonin networks and can lead to the so-called post-concussive syndrome of headaches, difficulties concentrating, difficulties with memory, mood changes, poor stress tolerance, difficulties with sleeping, and hyperanxiety states. All those may represent the effect of head trauma on destabilizing these networks that may generate the post-concussive syndrome. So before you have your next concussion, check to see if you might be at risk for this particular syndrome. So what can neurologists do for people who have migraine patterns? Well, first we have to recognize that migraine is actually a neurologic disorder. There's something wrong with the brain's internal circuitry pattern. So to help migraines and reduce them in their intensity and frequency, we have to act on the brain. Not just pain medicines, but actually work on brain processes. Over the course of recent decades, physicians and researchers have come up with a number of different chemicals which seem to interface with this serotonin network and act to stabilize it. For the individual who has the single isolated migraine, where the system simply went from a stable state to a hyper-unstable state, what you really want to do is grab the instability and reduce its level of fluctuation and return it to a more stable state so its system stops activating. Probably one of the best methods we have are medicines called triptans. You may recall some of those names of things like Imitrex or Maxol, Zomig, and such. Triptans were chemicals which were created in the laboratory for the purpose of binding to brain serotonin receptors and modifying their activity. So during the acute phase of a migraine, if you took a triptan, you may be very fortunate to find that the triptan binds to your brain serotonin system and somehow results in it restabilizing or at least turning off the headache pattern. And that's fine for people who have the occasional migraine. But if you get to the point where you're having many, many more migraines and low-grade headaches, and you're kind of fluctuating in and out of these headache states, then you're probably best to use a neurologic medicine to try to stabilize these networks so they stop activating. These are called preventative or prophylactic medications. Their medicines are used every day for some limited period of time to see if it's possible for that agent to work on your brain circuitry and convert it into a more stable pattern. And there are a variety of medicines which have been approved by the FDA for this purpose. Some of them come from unusual fields. For example, Depakote and Topamax are both seizure medicines used to stabilize hyperactive neurologic circuits that produce epilepsy. Well, used in small doses, Depakote and Topamax, if used on a daily basis for a limited period, maybe a month or so, may be effective in restabilizing these networks. And you would know that because you see that the frequency and intensity of headaches are becoming less active. It's becoming a smaller and smaller problem, and maybe the entire tree will begin to get smaller in some ways. Topamax and Depakote are both seizure medicines administered by physicians for the purpose of trying to regulate the frequency and duration of migraine headaches. An older class of medicine comes in the world of cardiology. Beta blockers are medicines used to regulate heart rate and rhythm. They rely upon the fact that the medicine modifies beta receptors in your heart. Well, there also are beta receptors in the brain, and somehow they're connected to the entire network of cells that are involved in migraines. And so for many years, simple beta blockers can be used to suppress activity in this network. For people who have a broader serotonin disorder where they have not just headaches, but a lot of psychic disturbances, some of those people are also served well by using serotonin reuptake inhibitors, like medicines like Lexapro or Celexa or Effexor, some of that class of medication. They can be helpful for a lot of the psychic problems, but seem to work best on the tension headaches and for migraines per se. So there are a variety of medications which can be used to help suppress headache patterns and make them more livable and tolerable. So I hope that this headache presentation was helpful to you to understand the neurologic mechanisms that generate migraine patterns. Migraines are normal and they're natural in some people. You need to understand the mechanisms involved, own it, and take charge of your own migraine patterns, and consult your doctor to find methods whereby you can stabilize these neurologic circuits and lead to fewer headaches during the course of your lifetime. Thank you for listening.